Hi everyone. So in this session I want to go through when it might be that you need to call a midwife with regards to labour and birth, and I also want to talk to you a little bit more about what to do, or signs of your water's breaking, and then at the end we'll tie up a few odds and ends, which hopefully will bring everything together that we have that I've tried to bring across in the whole series of videos that we've done on the labouring and birthing process. Of course, it's quite a common theme that women and their partners want to know when it is that they should ring us, what's the right time to ring us. And what I want to make clear is that actually there isn't a particularly right time. A lot of it will come down to you and when you feel that you want some advice from somebody. So the advice that I'm going to give you today is not the absolute set in stone advice on when you should ring us. Please ring us sooner if you feel you need us, at any other time. The rule of thumb is, though, that if you are managing at home in labour and you feel like everything's okay with you and your baby, and that you've not been advised by any healthcare professional to ring sooner, then probably if you're having your first baby, you would be okay to ring us when the contractions become regular, they become strong to the point of where you're really having to focus your breathing through them, and they're coming about every 5 minutes, and each contraction is lasting a good minute long. And if you can manage, it would be a good idea for you to allow the contractions to become this regular for about an hour before ringing us, because then you've got more chance of when we do talk to you on the phone that things are really beginning to establish. If it's your subsequent baby, second or more baby, then it might be that you don't want to leave things that long, because as I've explained in previous videos, subsequent babies can come quicker than the first. It is normal with subsequent babies to still go through the early phase of labour, which can, take a little bit longer. But once you hit established labour, when you're having your second or subsequent baby, then things really can start to pick up pace. So for you, I would suggest that you wouldn't leave your contractions every 5 minutes, lasting a minute long, for more than half an hour before giving us a ring. Other times when you might want to ring us when you're at home in the early phase of labour is if your baby's movements are less or different than they normally would be. We would still want your baby's movements to be in their normal routine pattern during the early phase of labour while you're at home. It's a myth that they should reduce down. We would expect them to remain the same. So if you're concerned whatsoever about baby's movements at any stage during labour or before labour starts, then please, the advice is to give your midwife a call straight away. Don't leave it. If you are feeling unwell in yourself, i.e. with a temperature or feeling unwell in any way, if you just want some reassurance, if you're worried about something, then please don't wait. It's never too soon to give us a ring. We can always advise you over the phone, and you can ring us back later, when you need us. And of course, if you experience any abnormal blood loss, that would be another time to give us a ring, because it's not normal to experience bleeding in labour. You might experience the loss of your mucus plug or a show, which is a jelly substance which is just inside the cervix before you go into labour. That can be a bit blood stained, which is normal. However, what is not normal is fresh bleeding or passing blood clots. If you get any of those signs, please give us a ring. Do not wait. And of course, you do need to ring us when your waters break, or if you think your waters have broken. So let's talk a bit more about the waters breaking in a bit more detail. So when you think your waters are broken or they're breaking, then you need to give us a ring. Now this can happen in a couple of different ways, and some women will experience it in different ways as well. When we think about the waters, the bag of water around the baby, as you become full term in your pregnancy, there's not much room for the waters anymore because the baby's fully grown and it's taking up much of the room in your womb. So what tends to happen is that you have pockets of water where there's gaps, and you have then a bulge of water around the top of the baby's head. The waters can go either from where the baby's head is, in front of the baby's head, and what tends to happen is that women will get a gush of fluid coming away, and it's like you can't control the water coming away. This is called a front water rupture of membranes. If you have the waters breaking somewhere from behind where the baby's shoulders are, in one of these pockets that are around the baby in the womb, then sometimes women will experience continuous dampness or trickling of fluid. So what's happening there is that the water pops, and then every time the baby moves, a little bit of water trickles down. So that's called a hindwater rupture of membranes. If the waters go from behind the baby's shoulders, it can sometimes be a little bit more difficult to know whether the waters have gone or not, compared to the big gush of fluid that you get and the continuous then trickling of water if they go from the front of the baby's head. However, whether you think they've gone or you're absolutely sure they've gone, it's important that we are aware of it. And the reason for this is that once the waters have been confirmed to have gone, if you don't go into labour within 24 hours of them going, there could be a little bit of an increased risk of infection getting to the baby, so we would then need to discuss other options for you at that point. The waters as well, we need to know what colour they are. So what we would advise is that at the point you think they've broken, pop a pad on if you haven't already got one on, and note the time that you think they went, because that will then obviously enable us to work out when the 24-hour window would be. And the waters can go at any time, either before labour starts, during labour at some point, or some babies can be born with the sac around them. And in that instance, the waters don't break at all. There is no right or wrong, and everyone's different. If your waters do go before your labour starts, the majority of women will start labour during that first 24 hours. But for the small amount of women that don't go into labour, then obviously we would be discussing with you further about what we do from that period on. We would expect the waters to either be clear in colour or a pinky tinge to them, or sometimes they might be a little bit kind of like straw coloured. What we wouldn't expect is them to be blood stained or green or deep yellow in colour. If you do experience that, then again, please make sure that you ring your midwife as soon as possible to let us know that. So that's basically gone over breaking of your waters, when to call the midwife. Again, please remember that the Brecon number you need to ring, or the call centre number you need to ring, is on the front of this leaflet there, 01874 622 443, and then ask to be put through to the midwife for the team that you belong to. The other thing I want to talk to you about is home assessments in labour. So what that basically means is that you ring your midwife to tell us that you think your waters have gone, or you think that you're going into labour. The midwife will have a discussion with you over the phone, and then we can make a plan with you whether or not we feel it's the right time to have an assessment. It might be, if you've got complex situations in your pregnancy, that you've been advised that you need to go straight to an obstetric labour ward to have an assessment. However, you are more than welcome to ring us to discuss that first. If you are low risk in your pregnancy with no added complications, then the advice is to ring your Powers midwife team, who would then come out, see you in your home, offer you a labour assessment at home, where we would be able to check things like your blood pressure, your baby's heart rate, monitor how often your contractions are coming, see how you're managing and coping at that stage in labour, and offer you an internal vaginal examination as well, if you wanted one, to see at what stage your cervix was at. At that point, then you could make a decision where you wanted to have your baby. So it might be that you wanted to stay at home, or you might have already got plans to come into one of our midwife-led units. If you are planning to have your baby in one of the bigger obstetric units, and you are of lower risk in your pregnancy, then of course you can discuss that with your midwife at the time. But going on the evidence that I've given you, hopefully it's given you a better understanding of the benefits that you would receive by having your baby away from an obstetric unit, because the labour wards are there for the women that really have complex needs and need the extra monitoring that wouldn't be needed in a uncomplicated pregnancy and birth. So what I now want to do is talk to you a little bit about why it's important that why the evidence has shown us what it's shown us. So I want to take us back to when we were early human beings and we were living in caves, and how the labour process has been designed to be effective in bringing babies into the world, and how it has worked really, really well since the beginning of time. So this picture here shows you a cave woman and a caveman. And what we've got to think about is that when this woman was going into labour back in those early human days, that she would have acted on instinct, as every other mammal does. And those hormones would have started to build and she would have started to have contractions. The first thing she would have done instinctively is to take herself away and hide herself somewhere private, somewhere secure and somewhere safe. Therefore, then the endorphins and the oxytocin could build and the adrenaline in her body would have been very low. So she would have been quiet. Therefore, predators would not have been able to detect her because she was not vocal. And her labour would have been less uncomfortable for her because she's full of endorphins, and the birthing process would have been quicker for her because she was comfortable and relaxed. Therefore, in this situation, safer because she can birth, get the process done, and get away from danger should it occur. Now, if this woman in these times, who was literally just acting on instinct, was in deep labour, but she was suddenly faced with a predator or a threat, then of course she needs to escape that threat. So her adrenaline levels would have suddenly increased so that she could stop labour and get up and run. Of course, we don't have those threats now as modern human beings, but what I want you to try and understand is that when you are faced with a threat in labour, when you are faced with a situation which is not familiar to you, labour can slow down, labour can stop. And when that process happens, the interventions have to then kick in to get the labour progressing again. So what you need to think about is ways, no matter where you're giving birth, ways to maintain your relaxation, ways to maintain your confidence and your inner ability and belief that you can achieve this process. Because the whole point of labour and how it's evolved is to make sure that you do it safely and effectively, and it enables you to stop the process and run if you're faced with a danger. So today's dangers are things like bright lights, are things like strangers coming into the room that you've never met before, are hearing machines go beep in the background. So it's always thinking about ways that you can maintain that environment. So keep your lights dim, keep the amount of people in the room with you as minimal as possible. Understand that if you are going in to have a hospital birth, you've potentially not met those midwives before, so give yourself time to get used to those midwives and understand that it's fine if the contractions do slow down. As midwives, we understand this, we understand physiology, we understand that when you change environments that you are not necessarily going to be contracting as you were when you were at home, because you have to remember when you're at home, that is your safe space. That is where the non-thinking part of the brain is going to assume you're going to give birth, and that's where it's going to want the process to happen. So although that you're not necessarily in that environment after you've hit established labour, when you go to where you are going to give birth, don't worry if it does all slow down. Give it time, get yourself relaxed, and it will come back and the process will happen. And also understand when you are leaving the home environment, whether that's going into a midwife-led unit or into a hospital setting to give birth, that take things with you that will help you to achieve this fine balance of hormone levels that you need for this process to work effectively. Take a pillow in from home that smells of home. Take something with you that familiarises yourself so that you can enter that kind of euphoric zone that you need to be in sooner rather than later when you get to where you're going to have the baby. So I'll leave things there. Again, as always, if you've got any questions on anything that I've talked to you about, please, don't hesitate to ring your midwives, and I'm sure they'll go through it with you in more detail.